It has a lot of benefits. So in a glance, these are the benefits of the usage of DEBRICHEM to your patient. So we're going to go through one by one in a glance in a short way. So number one, it can remove biofilm infection. As we all know, our wound got a lot of biofilm and banyak infection, banyak kuman, banyak bacteria. So in a way, untuk kita matikan all this kuman and bacteria is by we use something to eradicate the organism, which is why in this case we use a chemical debrider. So this chemical debrider helps untuk matikan semua kuman, matikan terus straight away, without even have to do other debridements. Okay, as simple as that. Number two, it is one single application. So you pakai sekali, you put few drops, and then after that you spread it all over on the wound bed. After that you wait for about 60 seconds. After 60 seconds, then you cleanse it off back again. Kita rinse off the DEBRICHEM, and then you do your standard dressing out procedure. Standard wound care dressing. After that, you put tutup, then ask the patient to come back after another 3 days or 4 days like that, and then you continue your standard care practice. So it's just one single application. Easy as that. It can be done by everyone, can be done by doctors, can be done by nurses, can be done by medical assistant. Whoever that is medically fit to do the procedure can do this thing, because it's very simple and it's very easy for the healthcare to use. It is safe for intact skin, means that it will not going to cause any problem to your healthy skin. Because we are afraid that it is very potent acidic properties. So we are afraid that if it goes to our skin, can cause skin damage. But actually tak ada ya. Kita punya kulit takkan jadi apa-apa masalah. Kulit kita yang bersih akan jadi cantik. Okay. It only affect on the wound area only. Because kenapa? Dia hydrophilic, which means dia tertarik kepada water. So dia akan bind with the water molecules. Bila dia binds with the water molecules, then the area will be desiccated atau dry. When it's dry, then bacteria akan mati. As simple as that. It is also effective against any antibiotic-resistant organisms such as MRSA, MRO, CRE, VRE, ESBL. We have a lot of these things, these bacteria in our hospital. They alert organism bacteria. So these kind of things, sometimes they are resistant to antibiotics. So when they are resistant to antibiotics, we need to find something that we can use to kill this bacteria, kill this organism, so that it can remove from our wound area. So this is very good against all bacteria, against all pathogens, against all viruses. Okay, as simple as that. It's easy for you to use, and then it will reduce the cause of chronic wound pain. Why? Because if you have chronic wound pain, which means that we have pain persistent for so long because we don't do anything. But when we do this, the bacteria will kill within 60 seconds, so they can mati. When it kills, then you have no more chronic pain because there's no more infection going on over there. So when there's no infection, there will be no more pain. So this thing actually has to eradicate the infection. And then it also helps in terms of cost effective because patient don't have to be admitted to the ward. So if you're done in a clinic setting, compared to the ward, because usually if in the ward, patient will be admitted for a few days, do a lot of procedures, when the admission causing them to use a lot of money. So instead of having admitted the patient to the ward, we can just do it in clinic setting. So in one time datang, pasang, letak ubat DEBRICHEM, after that patient can go back. And then you follow up back after 3 days and you see how the wound progress. So as I said just now, DEBRICHEM actually is a hydrophilic, which means that it attracts to the water molecules. When it attracts, it causes the area to be desiccated ataupun dry, dehydrated. When you dehydrated, after that causing the bacteria to be dead because there's no more water over there. Our living organism needs water to live. So bila kita dah tarik dia punya water content, we took out the water away, so they will die. So that's how we kill the organism. That's how you become dead. So these are some of the cases we've been using of DEBRICHEM in our hospital, in Hospital Ampang, for sharing knowledge with all of you, so you guys can see. So I used DEBRICHEM on a patient with venous leg ulcer, VLU. Of course, we use this also at the same time we do standard dressing procedures, and also we put them on compression bandaging, okay, because it's venous leg ulcer. So in this case, it's a case of 46 years old man with hepatitis B, diagnosed with vascular leg ulcer for 4 years duration and refused any surgical revascularization. So he don't want any surgery, dia tak nak apa-apa, dia nak buat dressing sahaja. Which is sometimes some of our patients like that kan. So apa kita buat, we do this thing, we put DEBRICHEM on top of the wound, just a few drops, about 2-3 drops, and then spread evenly. After that, kita rinse after 60 seconds, dan kita letak standard wound care and compression therapy. Dressing macam biasa, compression therapy, and then after that, after 3 days, it looks like this. And this is before we apply DEBRICHEM. Still looks a bit cantik with our dressing, but then we suspect there's a biofilm over there because it's shiny on the top of the wound bed. So because of that, we don't want that. We want a very clean wound without any signs of infection. So we put DEBRICHEM on top of this wound. And after 3 days, you can see after we put DEBRICHEM, we become black. This is normal procedures. Even normal jadi macam tu. Dia jadi because carbonized, jadi warna hitam. Okay, but after that, after 3 days, you put patient on dressing, and patient come back another 3 days, you can see the wound tu jadi macam warna colour macam ni, warna kuning-kuning, bit yellowish colour, bit like cheesy colour. So after that, this one is very easy for you to remove. You can use just use gauze and then just drop on top of it, and then you can jadi clean like this after 1 week without doing any hard surgical intervention. We just use mechanical debridement sahaja. And then this one, it looks a lot of granulation tissues and less exudative, and less macerated edges. So we continue our dressings for another 2 weeks, become granulating well. Epithelialization also can be seen on the wound. We continue until about 6 weeks, and the wound become much more smaller and with good granulation tissues. And then after about 8 weeks, it reduced in 80% of size compared to in the beginning. So it's as easy as that. So instead of using sharp debridement, instead of having to be admitted to the hospital, kita buat kat clinic setting sahaja. It's as simple as that, and anyone can do it. Even nurses pun boleh buat. Not have to do the doctors for you to do. Apart of venous leg ulcer, we also use this on a diabetic foot, which is very common. We've got a lot of cases of diabetic foot with infected and also biofilm, right? So in these cases, apa kita akan buat is kita put, like this case, I put them, a 48 years old man with underlying diabetes mellitus type 2 diagnosed with right big toe diabetic foot ulcer like this. Initial presentation was like that. Looks like okay, still can do some debridement, but patient refused to be admitted to the ward. Kata ada a lot of problem issues at home, so he don't want to be admitted to the ward, so he just want to do dressing only. We already explained that there's a risk of amputation, but he still don't want. Dia tak nak potong, dia just nak dressing sahaja. So we can still cater to that. We can try. So we try with normal dressing first, whether it works or not. But after 3 days, become much more worsening. And like this, if you tell the orthopedic thing, they will tell to the patient they need to be cut off, amputated, right? Look at it, also looks very infected, and also got a lot of thick stuff over there, got pus come out as well. But patient still refused for any surgical intervention. Tak nak, degil. So the very stubborn patient, don't want to do anything. He still asks for just doing dressing sahaja. Okay, we do dressing, can, but we tried DEBRICHEM. Apply first DEBRICHEM on top of the wound. We tell the patient that this one maybe become worsening because there's a lot of infection going on inside kat dalam, dah teruk. So we try, we put on DEBRICHEM, and then dah jadi hitam, but darken, the big toe become darkened. And we continue with our standard care procedure of dressing. After 3 days, it become much more extensive, which means that the infection has been going down deeper inside without patient knowing. So sekarang bila jadi ke dalam, when it goes like this, patient knows it's a very bad infection. It goes deeper inside. The DEBRICHEM actually help us in eradicating all the bacteria. It helps us in removing all the bacteria with using like this. So still don't want to be admitted to the ward, still just want to do dressing, so we continue dressing. We continue, and then after 3 days, still admission, but I explained to the patients that it's very dark over the distal toe, so we need to remove it, whether he agrees or not. But if this articulation, he agrees. Because I told him that if you don't articulate the big toe, the distal toe, it will affect the proximal big toe. So he said, okay, can potong the distal big toe. So we disarticulate the big toe, and we continue our standard care of dressing, and continue so far until about 1 week. Swelling is still there, but there's no more pus. There will be a slough tissues inside the wound area, still exudative, but then it looks quite okay still. So we continue dressing another 2 weeks on DEBRICHEM. We use now we use gel dressing. Continue dressing until about 3 weeks of DEBRICHEM. There's a bit slough over there, but it looks much more better than the beginning. Okay, without having to lose his big toe. So at least we can save his big toe at that particular time. Continue dressing. After about 4 weeks, there was slough of 20%, but still swelling over there. Then about 5 weeks, we're just using normal dressing. And then lastly, until about 8 weeks, we managed to close up the wound. So patient still have his proximal toe, still can walk well. So there's no amputation has been done, and he's happy with the result. So there's no ward admission as well. So we did that within 2 months in just doing in clinic sahaja, clinic setting. Okay, so it helps him in terms of get back to his good quality of life. We also did using DEBRICHEM using on a case of a pressure injury wound. So this one pressure injury, we use it on a bed sore wound. Okay, this is actually a case of 40 years old man, paraplegic because of spinal cord injury. He was diagnosed with pressure injury over the sacrum and gluteus. There was a bit of local infection over the previously divided wound area. So initial presentation was like that, a bit of eschar tissues, but it's hard to debride because it's always bleeding. So it's very, very fragile skin area. And then what we do was that we put him on DEBRICHEM, And this is what happened directly after we put DEBRICHEM. It become black color tissue, but it's still okay. Then we wait for another about 3 days. After 3 to 4 days, it become much more clearer and much more better. So patient don't have to be admitted to the ward, and then we continue dressing as per procedure. Okay, as easy as that. Don't need to be admitted to the hospital. Another one case is a case of we use on a heel pressure wound. This one, she was presented with with eschar over the heel region and bit of bleeding as well. She's on anticoagulant, so we cannot do any sharp debridement. Kalau kita buat sharp debridement, it can bleeding. It will bleed. So if it bleeds a lot, then it will be difficult to stop the bleeding in clinic setting. So what we did was that instead of using sharp debridement, we used a DEBRICHEM to remove all the infections. So this is the initial presentation, and after about 4 days, after we applied DEBRICHEM, after 4 days, it fall off by itself. The necrotic tissue, it got fall off by itself without having to do any sharp debridement. As simple as that. Then we continue. After about 2 weeks, it become much more better and about to heal. Okay, without having to do any vigorous intervention, just using DEBRICHEM. Another one case, we use it on a chronic post-surgical wound. This one is very bad wound. We use a case of 45 years old man with morbidly obese with necrotic fasciitis over the left leg, over the right leg. So initial presentation, there was a bit of black discoloration over there. There were eschar tissues and a bit of granulation tissue that much, but there were more of eschar tissues over there. So what we did was that we tried to put him on DEBRICHEM. This is actually before we applied the DEBRICHEM. The black color tissue is still there with the standard care of dressing. So we apply. This is how we apply DEBRICHEM. It become blackish discoloration of the skin of the wound area. It become black. But pain score was about 2. It was still okay. So we will continue with our standard care of dressing and compression bandaging. This is 4 days after we apply DEBRICHEM. It become much more lighter color. And after that, we continue with another 4 weeks. Become clear everything. There's no more black eschar tissues. So without doing any surgical intervention, without any sharp debridement also as well. So it does help in terms of eradicating the bacteria over the wound area, and it helps in terms of getting better life for the patient as well. So as a sum up, to conclude about today's talk, usually we always get cases like patient coming to pukul 4:45 kan. When we are about to tutup clinic, patient akan datang. Patient datang with bad infection, with lost love tissues, everything. So what we're going to do? Sekarang kita nak deny the patient, right? So we still have to accept the patient that comes in. And then when we see the patient with bad infection, what we need to do? We always think that for us the doctor, we gonna say, okay, ni kena masuk ward. Tapi the nurses kadang kata nak cepat, nak ambil anak lah, nak pergi masak lah whatsoever. Dah kata aku satu, dan nak balik rumah dah. Patient pula akan fikir lah, money gonna come out because dia kena masuk ward, gonna cost a lot of things for the patient. So instead of having to be admitted to the ward, instead of having to do a lot of procedures to the patient, why don't you use DEBRICHEM? Which is easy. You just apply on the wound for a few drops and then leave it for 60 seconds. Apply, lepas tu spray it out. Leave it for 60 seconds, then you rinse it off. Lepas tu baru you put your punya dressing procedure macam biasa. The way you boleh combine with any dressing that you want. After that, close it up and then ask patients to come back again after 3 days. Sedang je, macam tu, as easy as that. So if any problem with your wound, if it's infected, always think of DEBRICHEM, because DEBRICHEM has all these properties that is good for your wound to heal. Okay? That's all. Just some sharing of cases in our hospital to you guys. Yeah.
From Perak, all these cases you apply only once, or do you need to reapply?
Okay. All the cases that I showed just now, I only applied once. And then within 1 month I applied once. And after that, we just continue with normal standard care of dressing until the wound heal. There are a few cases that I reapplied, but I usually reapply back after I assess the wound, and after about 1 month after the first time I put on DEBRICHEM, then I reapply back. Usually, how deep? Usually, it doesn't go up. How deep? Usually, from my experience, it doesn't go deeper to the bone tissue area, no. Just at the superficial area only. Sometimes yes. So if the thing happen, you need to evenly spread the thing first on the top of the wound. Then you can see whether it can goes deeper or not. Or another one way you can use is that when you put a DEBRICHEM, you can see it become black color. And black color tissue means it's already been carbonized, which means that it already goes to deeper inside. If the area that you put the DEBRICHEM is still not black color, means that it's not fully utilized at that area. So you can apply a little bit more. Right, no problem. After apply DEBRICHEM, I think after wait for 60 seconds, lepas 60 seconds, you rinse it off. Memang kena rinse it off. Rinse off. Rinse off je. Lepas tu letak dressing. Boleh combine with any dressing that you want. Tak ada masalah. DEBRICHEM. 60 second, 60 saat. 1 minute. After 60 seconds baru you rinse it off. For the first 60 seconds tu biar kat situ. Then after that 60 seconds you will see they start to jadi warna-warna hitam, warna gelap-gelap. Then after habis 60 seconds you rinse off dengan sterile water lah. Yes, acidic. Okay, pain-wise, some patients will complain of pain, but diabetic patients usually have no pain at all. It's pain threshold. But vascular patients will complain of pain, vascular wound. Bad sore patients sometimes complain of pain. But my cases, my vascular patient they complain of pain with pain score of about 4. My bad sore patient has no pain at all because he's paraplegic. My diabetic foot patient has no pain at all. But some cases that I read through, they say that they do have some pain. But if the patient have pain, you can put local anesthesia on top of it. Letak lidocaine gel ke, nak letak amla ke. Yes, before application, yeah. Okay. Okay, I was told that you can only use once in 1 month. So you cannot do hari ni you buat the next week you put back again, cannot. You can do that once now. After that you can have to wait at least another 1 month and then you can reapply back.